All right, so in this particular discussion, we'll look at the female reproductive system. So with a particular focus on the internal reproductive system. So bearing in mind that the external genitalia for the female reproductive system is composed of the vulva and the mons pubis. That's the mons pubis. It's an area that lies superficial to the symphysis pubis. That is the symphysis pubis. The part of the bony pelvis. So the two hip bones meet at this point, known as the symphysis pubis, formed by the fibrocartilage joint. Now in female, this area, of course, is covered by skin like males, but underneath the skin, this area is specialized to store huge amounts of white adipose tissue. So that is known as mons veneris. That is mons veneris, which is absent in males. So what we are seeing here is a clitoris. That's a clitoris there. Then there we have the labia majora, the labia minora. Then we have the urethral orifice, external urethral orifice, which opens in the vestibule. The vestibule is a space between the two labia minoras. So in terms of relationship, the urethral orifice or opening is located superior to the vaginal opening. At the same time, is located anterior to the vaginal opening. So it is anterior and superior to the vaginal opening. So that is the vaginal opening there. Of course, bordered by the caruncles. So the caruncles are the remnants of the hymen. So the hymen partially closes the vaginal opening in a female that has not yet experienced sexual intercourse. So this is found in younger children. Okay, but in sexually active females, we just find the hymen caruncle. Right. So that is a vulva. Now we are going to focus on the internal reproductive parts of the female reproductive system, starting with the inferiormost part, which is the vagina. So that is the vaginal tube, which is located inside the pelvis there. Then what we see on the vulva is a vaginal orifice. So before we even go any further, I would like us to appreciate that the vagina lies in between the bladder and its urethra inflant, and the rectum and the anal canal posteriorly. So you have bladder and rectum sandwiching the vagina in between. Okay, let's see what we have. So those are the parts of the internal female reproductive organs. We have ovaries, which are bilateral. So we have two of them. Then we have uterine tube. We have the uterus and the vagina itself. So these are the ovaries. One will be on the other side as well. So two ovaries, left and right ovary. Of course, suspended by the ovarian ligament. So that's the ovarian ligament that is connected to the uterus. Then we have the fallopian tubes, left and right. So that is the fallopian tube, or you can simply say the uterine tube. So this is quite a long tube and it's highly tortuous. So it is coiled. It's not a straight tube. It has some coiling. In addition to that, we have the uterus, which is a unilateral organ, lies in the midline. So it's just one organ. Then we have the vagina at the inferior end. So uterus has those parts, the fundus, the body, the cervix, and the isthmus. The isthmus is the point where the body of the uterus is connected to the cervix. So this is the vagina, and that's what we'll look at first. Then these are parts of the external female reproductive organs. Okay, of course, these are discussed in the previous discussion that I earlier discussed. So here the focus is on the internal female reproductive system, starting with the vagina. So that's the vagina there, as we are seeing. So first of all, I'd like to mention to say the peritoneum. This is a membrane that covers the abdomen. So it is divided into two parts. There's inner peritoneum and outer peritoneum. The inner peritoneum is in contact with the organs of the abdominal of the abdominal cavity, whereas the outer peritoneum lies or lines the walls of the abdomen. So we call it the parietal peritoneum. So this is the one we are seeing here. So the parietal peritoneum extends all the way into the pelvis. This is the pelvis. So it forms a tent on the superior surface of the pelvic organs. So you can see that grayish line, that is the peritoneum. Then above, so all this space is abdomen. Below that peritoneum, that space is pelvis. So all these organs here we are seeing in the pelvis. On their superior end, we find that they are covered with peritoneum. Now, since the peritoneum is covering these organs, we find that there are spaces left between the uterus and the vagina, and the bladder in front, and the rectum at the back there. So we're talking about these spaces here. That space between the vagina and rectum, and between the vagina, uterus, and rectum. Then there's this space between the uterus and the bladder. So these spaces are given names. So the space between the bladder and the uterus, of course, will be covered by the peritoneal membrane. You see that peritoneum coming down like this and then folds. So this space is in form of a pouch because of the peritoneum that dips in that space and creates a pouch. So whatever is in the abdomen, like there, for example, if there's bleeding in the abdomen, that bleeding will not reach the pelvis because there's no communication between the pelvis and the abdomen. So we call them as pouches. So there's the anterior pouch, which is here, and the posterior pouch. So the anterior pouch is a pouch between the uterus and bladder, and we call that as a vesico uterine pouch. Vesico or vesicle, if you like, vesicle uterine pouch. That is a pouch there. Then the one posterior is a pouch between the uterus and the rectum. We call this as a recto-uterine pouch. Recto, meaning rectum, uterine, uterus. Pouch is this space. This space is further known as the pouch of Douglas. So this is a pouch of Douglas, or simply the recto-uterine pouch. Anterior pouch, posterior pouch. So the pouch of Douglas is a significant pouch because in cases of in an event that the woman has ectopic pregnancy, and maybe that ectopic pregnancy has ruptured, most of the times the blood will collect here in the recto-uterine pouch, or pouch of Douglas. Okay, so what is done is a caudocentesis. So caudocentesis is where you're aspirating content from the pouch of Douglas. So a needle is inserted through the vagina, then perforates the posterior vaginal fornix, and then all the way into the pouch of Douglas, then aspirate. Usually you find blood there. And for example, if there's infection in the abdomen, pus can also accumulate in that pouch of Douglas. That being said, let's look at the vagina in some more greater detail. So I'll use this diagram, this one here. So posterior is rectum, anterior is bladder and urethra. So the vagina has 3 walls. So these are boundaries. So anteriorly, we have this anterior wall. Posteriorly, we have this posterior wall. Then we have the 2 lateral walls. So that is the lateral wall, left and right lateral wall. As we are looking at that, we see that the anterior wall is short compared to the posterior wall. So this is the posterior wall. It tends to be longer than the anterior wall. Then the uterus and its inferior end, which is the cervix, enters into the vagina. So that will give us dilations in the distal end of the vagina. So we call those as fornices, if they are plural, or fornix, if it's singular. So these are dilations in the distal end of the vagina. So there's anterior fornix and posterior fornix. Then we also have the lateral fornix. Lateral fornix, left and right, lateral fornices, since they are plural, or fornix, if you like. Right. So the posterior wall is longer, it's about 9 centimeters long, whereas the anterior wall is shorter, it's about 7 centimeters long. All right, now the vagina is a muscular tube, so it's able to stretch. If you compare, the penis is about 18 or so in length, 18 centimeters, roughly 12 centimeters going up. Okay, but here we are talking about now 9 centimeters and the rest. So the reason why the vagina can accommodate the penis is because of its stretchability. At the same time, it allows birth of the fetus that was previously occupied in the uterus and can expand and allow the fetus to be born. So those are the walls of the vagina. In addition, if you examine the tube of the vagina, you see that the vagina has folds. Those folds are known as rugae. We have similar arrangement in the bladder, the stomach. We call them rugae. So it means these organs have ability to stretch. When food is filling in the stomach extends. When there's no food in the stomach shrinks, so the volume is smaller. Same with the bladder. If there's urine, the bladder stretches. There's no urine, the bladder constricts. So what happens also, the same with the vagina. The vagina can expand or constrict depending on what is taking place. Okay. So that being said, we can now look at the histological feature of the vagina. So the vagina will have the following layers. It will have mucosa. Okay. Now this mucosa has a thin submucosa. That's it, submucosa there. Then we have the muscle layer. Then finally surrounded by adventitia, which is connective tissue. So 4 layers: mucosa, submucosa, muscle layer, and adventitia. Okay. That being said, what type of mucosa do we find in the vagina? So the vagina is composed of stratified squamous epithelium, non-keratinized, similar to what you find in the esophagus. So in terms of comparison, the two tubes are similar. They have so much in common. They are both fibromuscular tubes. Okay. And they have stratified squamous epithelium. The only difference is that in the esophagus, this layer, the submucosa, will have glands, what we call esophageal glands. These are simple acinar glands. Sometimes they are branched. And these glands produce mucus in the esophagus. And that mucus aids in lubricating the food that is passing through the esophagus to avoid friction. But in the vagina, we don't have such kind of arrangement. So the submucosa is devoid of glands. There are no glands here whatsoever. But you can see some blood vessels and a lot of connective tissue cells. There are fibroblasts and all those cells of connective tissue that we earlier discussed on. Then when it comes to muscle, the vagina is composed of, poorly arranged muscles of this tube. Elsewhere, we see that there is inner circular, outer longitudinal muscles. So that arrangement is similar also in the vagina, inner circular, outer longitudinal. But when you examine, we find that the distal end of the vagina, the anterior end of the vagina. Let me take you back to the previous diagram. So here, this is a proximal. If you are looking at the vagina from the entrance, this is the anterior part, this is a posterior part. So the anterior part of the vagina is composed of skeletal muscles, or what we call voluntary muscles. These are muscles that we have control over. Okay. Whereas the posterior end is composed of smooth muscles that we don't have control over. Okay. At the end of the day, it is simply a muscular tube. So you have skeletal muscle at the beginning, and then the far end, we have smooth muscle, similar to what you saw in the esophagus as well. But the esophagus has 3 parts. The first part is skeletal, the middle part is mixed, then the part that is closer to the stomach is made up of smooth muscles. So that is it about, the vagina. So like we are saying, the rugae there allow the vagina to stretch. Okay. So that is still the vagina. Let's look at the, in addition to that, we're saying the vagina also stores huge amounts of glycogen. Now, this glycogen is essential in the sense that, remember, after intercourse, the sperm cells will be deposited in the vagina and may stay there for some time. Then they will need energy to swim all the way from the vagina through the uterus up to the fallopian tubes. So glucose is converted to glycogen and stored in the vagina. Okay. So this is essential for survival of the sperm cells. Okay, so this glycogen storage are stored in this muscle layer as well as in the epithelial layer or the mucosa layer, if you like. In addition to that, we are going to find various microorganisms in the vagina. We have bacteria as well as fungi. So there's a bacteria known as Lactobacillus acidophilus. Lactobacillus acidophilus. So this is a normal flora in the vagina, and it helps to maintain the pH of the vagina, which is ranging between 3.5, and 4.5. Supposed to be the other way around. Okay. Let me just correct this one. Yeah, supposed to be that way. So that is a pH range of the vagina. So this is quite an acidic environment, and it inhibits growth of other microorganisms. In addition to this, the vagina, like the mouth, has presence of fungi known as Candida albicans. So Candida albicans is a normal flora of the vagina, but it's a fungal type of normal flora, also found in the oral cavity. So this plus the pH environment of the vagina prevents growth of other microorganisms. Therefore, the vagina is said to be self-cleansing. You don't have to add any type of chemicals to clean the vagina and so on and so forth. Okay. But again, the activity of this bacteria plus the fungi, and since these microorganisms break down carbohydrates incompletely, you find that this may lead to production of some foul smell that is associated with some individuals where they fail to get rid of that smell. Okay, and that may disturb the pH of the vagina. But in most cases, it's not a very huge problem. But cases where individuals report, for example, with fungal infection, what is called vaginal thrush. For example, if this microorganism is transported from one person to the other, one female to the next, it is going to cause infection there. So the new candida in this new person will lead to increased proliferation of the candida and may allow growth of other microorganisms. So as a result, you see that this person will present with itchy vagina as well as pus discharge because of death of some cells, which will form pus. So vaginal fungal infection or vaginal thrush can be sexually transmitted. Okay, so one partner or a male partner meeting with two different females. Okay, the other female may receive candida from another host, and that may cause infection. Other than that, it can also be transmitted via fomites, like using a toilet pan upon which another person has used, and then that microorganism reaches your vaginal tube and may cause infection, like the way I've explained it. Okay. So that's all about the vagina. We can look at the uterus. Okay. So the uterus has the following divisions. So this is the body of the uterus, the most dilated part. Then we have the fundus, the superior part of the body is known as the fundus, just like we had fundus in the stomach. Then in the inferior end of the uterus, we have the cervix. Cervix means neck. So this is a point of connection between the vagina and the uterus. Then between the cervix and the body, we have what we call the isthmus. So that is the isthmus there, connecting the cervix to the body of the uterus. In addition, the uterus has a cavity, so we call that as a uterine cavity. Then the cervix has a canal, so we call that as a cervical canal. Now, this canal is connected superiorly to the cavity of the uterus, inferiorly to the cavity of the vagina, or the canal of the vagina. Therefore, there are two orifices in the cervix. There's an external orifice connecting the cervical canal to the vagina. Then we have internal orifice connecting the cervical canal to the uterine cavity. So internal orifice, external orifice. In addition to that, the shape of the uterus is said to be like a pear. There's a fruit known as a pear that resembles the uterus. It's broad superiorly and narrow inferiorly. Okay. So those are the parts of the uterus: fundus, body, and cervix. Connecting the cervix to the body is the isthmus. Okay. Let's look at the histology of the uterus. Okay, before we look at that, let's look at the position of the uterus in the pelvis in relation to the vagina and urinary bladder. So the uterus is said to be antevasion, leaning forward, and antiflex, bending forward. So this diagram will help us to understand that. So antevasion, the uterus leans forward. So it sleeps on the superior surface of the bladder. Then antiflex, it is flexed forward. So this is a point where the uterus is connected to the vagina there. So if you think of this as a joint, and you know that joint undergo flexion and extension. Bending of a joint, we call it flexion. So if this is a joint between the uterus and the vagina, then this joint is flexed, it's bent, it's not a straightened joint. So you see that it's bent forward, hence the name anti-flex. Anti means anterior. So the uterus is anteriorly flexed and anteriorly leaning. It's leaning forward. So those two terms are essential in describing the normal position of the uterus. Okay. Then here we mentioned that is anterior fornix. That will be the posterior fornix. These are the dilated ends of the vagina. Okay. That being said, let's look at the histology of the uterus. So histology of the uterus, I'll use the diagrams that we have here. Let me just get one slide from here. Just hold on. I'll put it right there. Okay. So this diagram here is showing us the uterus at different stages. The uterus of a newborn, uterus of a 4-year-old, uterus of a female at puberty. So focus on the layers of the uterus. So that is the inner layer. We call it the endometrium. This is a middle layer. We call it the myometrium. Then outside is the perimetrium, a layer of connective tissue. Let's look at it in slightly more details. So I'll start with the endometrium, the innermost layer of the uterus. Okay, there's a diagram that I'm looking for. Okay, I don't have it here. Okay, this one. So if you see that yellow space there, or that yellow shade, that is the mucosa, or the epithelium, if you like. Then beneath the epithelium, we're going to find submucosa. Submucosa is connective tissue. Just like in the digestive system, you have mucosa, submucosa, muscle layer, and adventitia. So similar arrangement is found in the uterus. Mucosa, which is epithelium, submucosa, which is connective tissue, myometrium, which is muscle. Then underneath the myometrium, there will be another layer of connective tissue, this time known as perimetrium. Now let's break down the endometrium first. So endometrium has 4 layers. The first layer being epithelium. This epithelium is composed of simple columnar cells. So these are tall cells. So we call them simple columnar cells. 1 layer only. So that is simple columnar epithelium. Then underneath the simple columnar epithelium, we have now the 3 layers of connective tissue. So the first layer, the layer that is closest to the simple columnar epithelium, is a layer of connective tissue where the cells are highly packed together. So we call it the stratum compactum because the cells are compacted together. So we call it stratum compactum. Then the middle layer of the connective tissue, we call it the stratum spongosum because it has cavities in it. Those cavities are created by glands. Okay. The cells are not as highly packed as together, so we call it the stratum spongosum. Then the third layer of this connective tissue is known as stratum basale, or basalis if you want, or the basal layer. So stratum means layer. So there are 3 layers of connective tissue in the endometrium. The stratum compactum, closer to the epithelium, stratum spongosum in the middle, and stratum basale at the bottom. Those are the histological features you see. 3 layers of connective tissue plus 1 layer of epithelium. If you combine them, there will be 4, and they form what is known as endometrium. Now, in terms of function, the endometrium is divided into 2 parts or 2 layers. So it's divided into what we call the stratum functionale, or the functional layer, if you like, and the basal layer or stratum basale. So let's look at the functional layer. The functional layer is composed of 3 layers. Number 1, the epithelium, which is simple columnar epithelium, the stratum compactum, and the stratum spongosum, ending somewhere here. So this layer is the functional layer, and it is a layer that is lost during menses. During menses, the uterus sheds off. It is the functional layer that is shed off. It degenerates. It breaks away from the uterus. What remains during that process is the stratum basale. So cells in the stratum basale are specialized to proliferate or to rebuild the functional layer. If this is lost, once the menses are over, the uterus begins to build itself using cells in the stratum basale. Okay, so that is a functional layer composed of 3 layers. Epithelium, which is simple columnar, stratum basale, stratum compactum, and the stratum spongosum. So this is a stratum basale there. Okay. But all of them, from the stratum basale up to the simple columnar epithelium, is known as endometrium. Okay, now, before we look at the muscle layer, I would like us to observe that the type of arteries found in the stratum basale and the functional layer are totally different. So, in the stratum basale, we find spiral arteries. If you can observe there, you see those arteries are coiled up. So this is a branch of the uterine artery, of course, coming from the internal iliac artery. I'll show you that much later on. So the uterine arteries penetrate the perimetrium, penetrate the myometrium, and the endometrium. Now, in the basal layer, they are spiraled like that. But in the functional layer, they straighten up. So you have straight arteries in the functional layer of the endometrium and spiral arteries in the basal layer of the endometrium. That's a major distinction. Last but not the least, the mucosa of the uterus has glands. So you see that gland extending all the way deep into the connective tissue, which is a stratum compactum, spongiosum, and basale. Now, these glands appear differently if you examine the uterus in different phases. Remember, the uterus has those three phases: the uterus when it's shedding, the uterus after shedding, and the uterus during ovulation. So we have uterus in the menstrual phase, uterus in the proliferative phase when the uterus is building itself, and uterus in the secretory phase when the uterus is ready to receive the zygote in an event that fertilization occurred. So the uterus, when it's in the menstrual phase, these glands are lost. Thereafter, the uterus enters the proliferative phase or the building phase. It starts to build itself. So what you see then are simple tubular glands, very small glands. Then when the uterus has finished building itself, the uterus goes into the secretory phase where it is ready now to receive the product of fertilization, which is zygote. During that stage, the uterine glands swell, they increase in size, and some of them may develop branches. So it becomes simple branched tubular glands, where they have more than one gland at the bottom. But in the early stages, it's just one duct, one gland. But in the late stages, it is one duct and multiple glands at the bottom there. Aside from that, the glands are well dilated during the secretory phase when the uterus is ready to receive the product of fertilization. And if you observe that, you see that the uterus will secrete a lot of, serous plus mucus secretion. Now, you can use that to determine the fertile stage of the uterus and the infertile stage of the uterus. So when the uterus is fertile, the uterus is in its secretory phase. So it's secreting a lot of product from these glands. And the discharge from the vagina will be very thin and loose and highly slippery. But if the uterus is not ready, like it's in the proliferative phase, and is not ready to receive the zygote, the secretion from the vagina, which is coming from the uterus there, you find that it will be thick and viscous. It's not slippery and it's very thick. So that way it can't allow sperms to swim all the way to the fallopian tubes. But if the secretion is loose and slippery, it allows and actually aids or promotes the migration of the sperm cells from the vagina through the cervix, through the uterus, and all the way to the fallopian tubes. Okay, so that is used during natural family planning. Okay, away from that, we look at the myometrium. So the myometrium is simply the muscle layer. So the muscle layer is shown here. What we're seeing here is a uterus in different phases: proliferative, secretory, and menstrual. Menstrual, the functional layer is being broken down and is shed off as menses. Here, the uterus is ready to receive the zygote. Look at the size of the glands. Compare here. Proliferative. It's just from after menstrual phase, what follows is proliferative. It's not ready at this stage. So now look at the muscle layer. So the muscle layer is this part here. That is a myometrium. So the myometrium, of course, is composed of 3 layers of musculature: the circular muscles, oblique muscles, longitudinal muscles, and the spiral muscles. Okay, but we find that in the cervix, there will just be 2 layers of muscle: the circular muscles and the longitudinal muscles. But in the body, the fundus, we have all those layers of muscles: circular muscles, spiral muscles, oblique muscles, and the longitudinal muscles. So in terms of contraction, when the uterus is contracting during menses and during labor, the body and the fundus has effective contraction and expels whatever is in here, okay, as compared to the cervix. The cervix will just dilate and open up so that whatever is in the cavity there is expelled, be it menses or the fetus. Okay. So that is about the muscle layer. So all these muscles are smooth muscles. Okay. So because of that, much of the uterus is just a muscle. And the size of the uterus is compared to the fist of the female herself. So if you make a fist, that's the size of your uterus. It's quite small. Okay, about 7 centimeters long and 5 centimeters in width and 2 centimeters in terms of thickness. It's quite a small organ, but can stretch to accommodate the fetus. Think of a fetus which is ranging about, should be 33 or 45, yeah, 45 to 50 centimeters long. That's quite, robust as compared to the size of the uterus when it doesn't have the fetus. So at birth, the fetus measures around that length, 45 to 50. That's quite long. Okay. So saying the outer layer now is a perimetrium. That is a perimetrium made up of connective tissue. Okay, so if you observe the previous diagram, we saw that these are the uterine arteries. Uterine arteries coming from the iliac artery. Okay, there's a diagram I have that I want you to see. Okay, I've lost that diagram. So these are the uterine arteries lying in the lateral ends of the uterus. Then from there sends branches anteriorly, posteriorly, superiorly, and these branches will now penetrate the perimetrium, myometrium, and endometrium. And then finally reach the endometrium in this fashion that we saw earlier on. Okay. Okay, yeah, these are branches now going into the endometrium to form spiral arteries and straight arteries. So if the woman conceives, the zygote will attach here and then sink into the layers of the connective tissue, the stratum compactum, basale, and spongiosum. So it's buried here. This is where the fetus will grow. So the fetus will not be found there in the cavity. Remember, after this, what is there is a cavity. Is that space in the uterus. Where is it? This space. Here. That is the space there. So the sperms will pass here, go to the fallopian tubes, fertilize the ovum, then the ovum comes as a zygote, then enters here, buries itself, what we call implantation. It's implanted, but doesn't reach the muscle layer. It will be there in the layers of the endometrium. So it will be here to grow there. So nothing will be there. And then these arteries now, when the placenta is formed, these are the arteries that bring blood that is oxygenated and with nutrients to the placenta so that the fetus can collect that. Okay. So that is the uterus. The next one we'll look at is the fallopian tubes. So we'll do that in the next session. Like I always say, if there are any questions, you can reach out to me and we can have a discussion. For now, we can end here.